Welcome to A State of Sight. I'm Isaac Porter, and this is your update in ophthalmology and eye care. We've been off to a great start with A State of Sight, and soon we'll be having our 50th episode. We've got some big plans to have live interaction for episode number 50, and we'll have more details about that coming soon. But today, I would like to talk about corneal hydrops and treating it with air or gas injection into the eye. If you remember back from episode number 21, which went into detail about corneal hydrops, that's a problem where the cornea, or the clear shield that covers over the front of the eye, can have a break on the inner layer and cause swelling and decreased vision in people that have keratoconus or pellucid marginal degeneration, or another problem called keratoglobus, which is a little bit like keratoconus, but the cornea is very thin and enlarged throughout. Now, when this happens, it can take a long time, maybe 3 to 4 months on average, for the cornea to become thin and clear again. However, in the past 10 years, there's been a newer type of treatment where we could inject air or a gas into the front part of the eye, where it sits in the eye and then can help to close the break and decrease the swelling more quickly. Initially, doctors were first trying to put air into the eye and let this air bubble float up against the back of the cornea in order to keep the fluid from accessing that area and to help it dry out sooner, and then give it a chance to heal while the inner layer resurfaces the area of the break and allows it to pump down and become thin again. As you know, with the air bubble, it always wants to float up to the top when it's in liquid. So in order for the air to get into the right position, patients have to lie on their back and look straight up towards the ceiling so that air bubble will float straight up. If you can imagine like this, looking straight up like that, the air bubble will come right to the very top. We call this a little bit like keeping the bubble on the trouble, and so in this case, when it's in the back of the cornea, that's where we want it to get sealed. Air or gas are frequently used by our retina colleagues to help seal a break or a tear in the retina to allow the retina to be flattened in an area of retinal detachment while the healing takes place. With this, when we put the bubble in the front part of the eye, there can be a risk for the pressure going high in the eye or blocking the pupil and causing an attack of glaucoma. Because of that, we will dilate the eye, or some surgeons will make an extra opening in the iris to allow fluid to pass. It looks like that this may be a good treatment for some people in order to seal or close the break and make the hydrops go away more quickly. However, there's some question because still many times it may take 3 months for this to recover and may cut a month or a month and a half off of the healing time. So then patients have to think if it's worth it for them to shorten the time for the hydrops to heal versus some risks from the injection like infection or high pressure in the eye. This is just one option. Other options include just waiting. So if you have any questions about corneal hydrops or how it may be treated, please post. We'll be happy to interact with you. And we hope to see you again soon, next time on A State of Sight.